What is breast cancer? We have cells in our breast that are changing and growing and dying all the time. When there is a disruption in that pattern and the cells do not die off at the proper amount of time, they start accumulating and growing and turning into a mass. The masses can be a benign mass or it can be a malignant mass. Some of the characteristics of breast cancer cells is they don't like to sit in there and they don't like to play alone. They like to make friends. So the longer that a breast cancer cell is developing in your breast, there's a chance that it can metastasize to other areas of your body, such as brain, lung, bone. So you want to catch breast cancer early. We use 3D mammography at JC Blair. That helps the doctor separate all those layers of tissue. It's kind of like fanning through the pages of a book. We're allowing the doctor to look at each page as they go along. The breast tissue itself, the little glandular tissue that's in there making up the breast density, the radiologist is looking at how dense that tissue is. And there are 4 categories of breast density. We have fatty, scattered, heterogeneously dense, and extremely dense. The first category is a fatty breast, and you can see there's very little white glandular tissue in here. All this dark area is fat, which allows the doctor to see a breast cancer more easily in a fatty breast. We have some vascular structures in here, a couple of calcifications. This is the breast muscle against the chest wall, and way out here on the nipple is the little BB sticker. The second category is scattered, and that just means that it's a little more glandular tissue showing up here, a little more white than the previous fatty picture. The third category is the heterogeneously dense category, and you can see it's getting more white with this more glandular dense tissue in here. Imagine if the doctor's trying to find a white breast cancer in this white dense material. It's really difficult to see through. And then the fourth category is the extremely dense. And you can see almost this 3/4 of this breast is very dense tissue. And the 3D technology we have does allow the radiologist to see every millimeter layer of this dense tissue. You may only have 4 or 5 images for your mammogram when you come, but when you leave, the radiologist who's reading your exam will have several hundred images to look at. And we're pretty proud that we were the first center in Pennsylvania, central Pennsylvania, to have 3D about 2 or 3 years before the bigger centers around us.